Howdy, we are group 2, and today we're going to be talking about incivility and bullying, specifically in the student-to-student relationship in nursing school. So group 2, we are Lauren Kaiser, Maddie Kirkendall, Emma Ambro, Kathy Mae Dow, Belle Hannah, and Tara Huen. And today we're going to be talking about the definition of incivility and bullying. We're going to talk about the consequences of student-to-student bullying and incivility, and we're also going to talk about strategies to relieving incivility and bullying.
Okay, so we're going to start off with the definition of incivility and bullying. And according to the American Nurses Association, incivility is one or more rude, discourteous, or disrespectful actions that may or may not have a negative intent behind them. The ANA defines bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. These can also be classified as acts of aggression. So, one thing we can use as Aggies is our core values to try and prevent bullying and incivility. And so, one core value that we thought that we could use is selfless service. And as nursing students, we can address problems between students by showing selfless service. This could look like using a mediator during disagreements, being the bigger person during arguments, and practicing healthy conflict resolution with rhetoric such as, I'm not sure if you're aware, but sometimes you can come across as.
We can also use the Aggie core value of respect, and this could look like involving faculty when necessary, a zero tolerance policy for bullying within a cohort, and self awareness for your own behavior.
The potential consequences of incivility and bullying on patient safety and other nurses are poor communication and unprofessional relationships have a direct impact on patient outcomes and safety. Two, physical and emotional distress can cause a loss of self-esteem, and students can feel subordinate, powerless, and feel judged.
Students will also see the behavior as a norm within nursing, and then it can form anxiety, low psychological well-being, low social adjustment, psychological distress, and risk of suicide.
So obviously there's a lot of potential consequences to incivility and bullying among students in nursing school. So it's really important to come up with specific strategies that we can use to combat this. I know Belle and Lauren discussed it earlier with the Aggie core values of selfless service and respect, but those are really essential in each of these three strategies in order to decrease the incidence of this issue. So first it would be teamwork activities. So this could be group case studies or interprofessional situations, kind of like we did with IBER. Additionally, having peer review opportunities. So not only participating in those teamwork activities, but being able to review and debrief after of what went well and what didn't go well, and being able to have healthy dialogue about critiques as well as encouragement that we have for each other. And then lastly, just maintaining a culture of respect. So obviously this can only be done by individually promoting respect in yourself and the way that you treat others. It's important to remember that we are all in this together to become nurses, and that will help decrease the incidence of incivility and bullying among nursing students.
Okay, so that was our presentation from Team 2, and then there are just a couple references we used. So thank y'all so much for watching.